Hello, I'd like to say welcome to Dr. Eric Ketchman, who is one of our expert speakers for the Treatment and Emergency Department's Knowledge Lab. Dr. Ketchum, welcome. Why don't you start out and tell us a little bit about yourself and your current work?
So I am an emergency physician by training.
Okay.
Been practicing for about 20 years at the residency, and I'm also an addiction specialist. I trained essentially at the bedside before there were many addiction fellowships available, and became board certified through that experience track. I put my fingers in a lot of different pies, so to speak. I work for the Presbyterian healthcare system, which is the largest hospital system in New Mexico. I work part-time as an emergency physician, so I'm still seeing patients in two of our emergency departments. And I also work half-time, so to speak, as an addiction specialist. And in that work, I see patients as addiction consult in the emergency department, in the ICU, med-surg, labor and delivery, and of course, hold a clinic 2 days a week for substance use disorder patients, and see all range of different substance use disorders. But as in most communities, it is opioid use disorder and alcohol use disorder, which both are rolling. I also do a lot of work for the state of New Mexico, grant funded work, educating hospitals, teaching them how to treat opioid use disorder, how to initiate buprenorphine and methadone in the hospital, and working particularly focusing on emergency departments, but now also working with hospitalists, and also particularly focusing on labor and delivery right now in the hospitals we're working with just around New Mexico. And what can I tell you? I've also worked with the medical director of a methadone clinic for many years, as well as what we call detox facilities, medical detox facilities. I don't really like the term. I find it somewhat stigmatizing, but in any case, medically managing withdrawals so we can help people transition to long-term medication, and a lot of advocacy work through the American College of Emergency Physicians and educational work through the American College of Emergency Physicians. Right. A long story. Sorry.
That's great. Thank you. How did you get started in this work? How did you end up as the addiction specialist that you are today?
Well, it goes back starting about 14 years ago, where I was practicing at the time. I was the medical director of a busy semi-rural, but regional trauma center emergency department. And we had a pill mill in town, and every day we had people withdrawing in our emergency department, seeing patients for opiate overdoses. And this was still when we were initially still dealing with predominantly oxycodone, oxycontin, and now it's starting to see more heroin at the time. And anyway, just facing the challenge of how do I keep the emergency department from being just engulfed with this disease that we just didn't really understand very well. And how do we keep people from dying in our community? And we tried a variety of different things, different rules, to make sure we didn't send them home with prescriptions, oxycodone and such. Ultimately, what I realized, if we could just get them hooked up with treatment, we just start them on buprenorphine. We also learned that we could make their withdrawal so much easier to manage in the emergency department, and we could get them on long-term medication. And the big challenge then was finding places to send them. So I embarked on another tour after we started doing this emergency department of holding X-waiver classes, educating doctors in the community, trying to teach them how to do this. So that's how it started. And then I did correctional medicine, wasn't planning on it. And then I started doing a methadone medical direction. Wasn't planning on it, just needed to keep a local methadone clinic from closing was my intent. And 7 years later, I was still the medical director of the center. So a lot of factors came together. And then, of course, my involvement with the American College of Emergency Physicians. Myself and a few other folks around the country going back about 70 years really could see the need for educating our specialty about this and expanding what we were doing. And this is folks on both coasts and a few in between, and myself in New Mexico.
Great. Thank you. So you just mentioned that work with the American College of Emergency Physicians and why you started it. Can you talk a little bit more about the organization and what you do now?
Yeah, so I am now finally a past chair. Right? So that was spent about a year with a colleague of mine from New Jersey, Dr. LaPetra, who really had a background more in pain management, and mine was in addiction medicine. And we knew that there was a growing group of folks interested in doing things with this in different pockets around the country. But it's a form of section. What that means is you have to have a big enough group within the American College of Emergency Physicians to get administrative support and funding. And then they help you with the organization and communication. And so we did a lot of marketing, promoting the idea, circulating it, and all the folks we knew. And then I just bought a whole bunch of memberships, so to speak, for the residents at the University of New Mexico to make sure we met the initial number. And now we're up to about 300 members across the country. But the section has really done profound work. And for the moment that we became a section, and even before we became official, the American College of Emergency Physicians was getting all kinds of grant funding. So we started doing more research from some of our members, and then folks like myself embarking on nationwide education tours and writing apps for your cell phone, guidelines, and all in an effort to really expand the treatment of particularly opioid use disorder. That was our main focus at the time within our specialty. And now within our specialty, we are now more education about treating alcohol use disorder and stimulant use disorder and such. But it really started driven by the opioid epidemic.
Great. Thank you, Dr. Ketchum. One final question, and just thinking about the folks that are thinking about participating in this knowledge lab. When you think about treatment in emergency department settings, can you share your perspective on why we need to pay attention to this issue?
The emergency department is really a special place where we have a real opportunity to make a difference. But a colleague of mine, Rupert Strayer, said it's where the patients are. And it really is where people with, let's say, if we just focus on opioid use disorder, for example, but we can extend this conversation to other substance use disorders, alcohol use disorder, et cetera. But it's where people come after an overdose. It's where people come when they are withdrawing and they don't know where else to go. It is where they come with complications of their drug use, such as infectious problems or sepsis or injuries sustained interpersonal violence, et cetera, all these things that happen. The common denominator is so often, where do they come? They come to the emergency department. And so we really have a very captive audience at that time. And we have an opportunity to really make a difference. And not only to initiate medication, to make sure they leave the emergency department with medication in their hand, but also to then connect them to treatment. And this has become even more important with the fentanyl era, right? Fentanyl, eating the free fentanyl, it has properties different from heroin, different from oxycodone. And it is much harder to transition to buprenorphine from fentanyl. So requires a more sophisticated approach, requires often more time in the emergency department, sometimes getting admitted to the hospital. And therefore, it's much harder for patients to do at home. And so they need the emergency department. They need the hospital, need run medical detox centers that have 24/7 nurses and a whole slew of medication we can use to help people make this transition. We need to be available now even more than before. And not only because of the properties of fentanyl, its high mu receptor affinity, its lipophilicity and other things, but also just because of the progressively enlarging involvement, the greater increasing prevalence. This is growing so fast, even particularly among adolescents now, right? So the need is growing for multiple reasons, but we really do have a unique opportunity. But also, we have a lot of patients who are now getting admitted to the hospital more so than before, just because of their kind of uncontrollable withdrawal. And therefore, it's not just in the emergency department, although it's an enormous place that needs focus and it's a great opportunity. But as what we do with the New Mexico Bridge Project, we not only educate emergency departments, but we educate hospitalists. We want to make sure that the nursing staff in particular is educated in the emergency department, in the inpatient unit. We educate clinic physicians and the folks up on labor and delivery. And so all of the areas really need to be educated on board. We offer opportunities in all of those areas for sure. Just an opportunity, bottom line, to save lives. And transform lives. I mean, really, it's when you give people their life back, it's amazing how rewarding it is too. It's not something you think about so much initially, but then when you see people are no longer withdrawing or craving or using it, and particularly if you then get the privilege of seeing them and follow up as an outpatient, and you see them have their lives back and working and paying their bills, job, and not in jail, and getting the healing the relationships with their families. I mean, substance disorders, while they kill a lot of people and they destroy so many people's lives, they leave a wake of destruction through families and communities. So when you heal somebody, when you help them get into treatment and stop using, you're often not just treating a person, you're treating a family, and community. So it really is profoundly rewarding as well, which wasn't something I thought about initially when I started doing this. I was really just trying to deal with the situation at hand. So,
Thank you very much for sharing that perspective. I really appreciate it. And I just want to say thank you for taking the time to chat with us before our upcoming Knowledge Lab. And we look forward to continuing the conversation with you during our Knowledge Lab on November 13th. Thank you, Dr. Ketchum.